Good afternoon, ladies and gentlemen. We're delighted you're with us today. Our webinar is going to begin. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council, and we want to thank you for joining us today for another one of our educational webinars, and it's hosted in coordination with NectarOM. They're an associate member of the council. Today's topic: reducing gaps in care through analytics and automation. This should be a great discussion. We're going to be talking about patient analytics, automated messaging that's going to help healthcare teams prioritize how they do outreach to patients with digital communications. The discussion today will also cover top 5 reasons why many hospitals fail at using analytics and automation, and give you advice and suggestions and ways to mitigate those failing hospitals. We're delighted that we've got with us today Amrik Kirpalani, the founder and CEO of NectarOM, and he's going to serve as our speaker today. His background includes much work with Fortune 500 retailers, CPG brands, financial service companies, in marketing analytics, and also in overall data management. Previously, Amrik built a marketing analytics consultancy, and he has worked with McKinsey & Company. His company now, NectarOM, has cracked the code on how to drive profitable revenue using customer data, and you personalize the customer experience. He really focuses on the simple premise that many human behaviors can be predicted. And NectarOM is going to be a leader in omni-channel personalization. Really looking forward to this presentation, and it's my pleasure to introduce to you Amrik. So Amrik, I'm going to turn it over to you at this time.
Excellent, Steve. Thank you for that introduction, and thank you to Chris as well from the council and all of the members that are part of the council that make this happen. Today's topic, as Steve discussed and pointed out, really focuses on this idea of reducing gaps in care. And I know it's a topic that many members, many of the participants in the call today think about regularly. I'm going to try to approach it from the perspective of behavior, from the perspective of some experiences that myself and my colleagues have in healthcare, but then also industries that are outside of healthcare that could provide perhaps a different vantage point and build upon the way we all think about reducing gaps in care. In terms of personal background, you heard it from Steve, spent my time in analytics and automation as topics over the last 20 plus years, combination of serving as a management consultant, but also built a couple different organizations, and super happy about some of that work. I live here in Dallas, Texas, in the Irving area, very active in the community, whether it's with educational boards, nonprofit boards, and then certainly some of the organizations over the last year and a half or so in particular that have been helping from a COVID perspective as well. Personally, just to give you a feel for the type of brands that I've interacted with and served and partnered with, it's everyone from TGI Fridays and Michaels, Best Buy, but also Allina Health up in the Twin Cities, United Health Group as the overarching behemoth in the payer space. So spent, I would say, a combination of my time and my experiences built off of it, where helping organizations of different types, whether it's retailers, whether it's consumer brands and healthcare organizations, focused on the topic of personalization. And using analytics, using technology, using automation to deliver personalization. And I always like to talk about an example that we all maybe engage with and interact with on a regular basis. I'm going to use a non-healthcare example, and I know it's overdone, but I think it's a really good one. Amazon.com. You know, a number of us probably go to Amazon. We make purchases, and suddenly, based on our behavior, based on what we click on, based on what we buy, we're getting various messages, and some of those messages are on Amazon itself. Recently, they started doing advertising over the last year and a half, 2 years on Amazon.com, but then you'll also see ads on different parts of the internet, or you may get an email in terms of a follow-up. That's the sort of behavior, that's the sort of technology that NectarOM builds, guides, and partners with brands to help deliver that type of experience, whether it's to a consumer, it's to a customer, it's to a patient, or even a member of a health plan. So that's a lens and angle that I try to bring to the conversation. In terms of the audience that I'm thinking about, just based on the input from Steve and Chris for today, as I understand it, members they really come from a varied set of backgrounds. Members could be clinicians, it could be team members in the compliance space, or we're thinking about regulation and rules that apply in the experience space. It could be patient experience, right? But then also operations and providers. And so what that means is I'm going to do my best to try to hit that broader swath. If there are questions, please post them in the chat, and Chris and team will view that on my behalf. But that's going to be the breadth of what we're going to try to cover today. So I'm not going to get into the way various systems should be set up, or the benefits of RPA, or robotic process automation, and how technology and modeling and such are going to help drive and change behavior in the future. I'm really going to keep it at a level where we ground ourselves on the gaps in care. We ground ourselves on what could be driving those gaps in care, and then move towards some thoughts on how we might be able to start addressing those more quickly, more collectively across the organization, and get to action. And so that's my task over the course of the next half an hour to 40 minutes, and I appreciate your time on the call. And so if you're open to it, if you'd like to participate and share some ideas as we go along, there's a website you can go to, and it's going to be a live feed sort of idea, no pressure. If you want to participate, you have certain ideas, there's some questions that are going to pose as we go along. Go to menti.com, M-E-N-T-I, as you see here. And you can do this on your phone, you can do this on the internet, on your computer, and then input this code 9226582, and you're not going to be registering for anything. You're not going to be putting in your name. You're not going to be giving your email ID or anything like that. It's literally going to allow us to do a little bit of sharing, where one of the questions, for example, I'm going to pose is, and you can look at it now, what examples of gaps in care have you seen? And so if there's gaps in care that you've identified, that you've experienced as you've engaged in your role, feel free to hop in here and provide it, and we'll maybe go over that in a moment or so and reference it and see if anything is coming from the group overall. And so, again, not to be overly pedantic and simplified, but I want to start from the perspective of, defining, when I think about gaps in care, and maybe a number of us in the call, what are gaps in care? And so on Menti, that's the question that's being posed. But in the most simple form, a gap between what providers, clinicians suggest should be done, and then what a patient actually follows up and does. Now, I think in the statement I just shared, we could think about broadening it and saying, what is driving those gaps? Well, sometimes it's the patient, and frankly, my primary belief, and Steve pointed out, a broad belief is that behavior can be changed. Patient behavior, though, is very hard to change. And so one of the biggest beliefs in terms of what's driving those gaps is patient adherence. Whether it's a patient following up on an appointment that they're supposed to have, showing up at the appointment. I mean, that's probably the most simplistic way to do it. But maybe it's post discharge. Maybe it's related to how you're supposed to take medication. There are gaps in care that also get created, though, because of I would say the disparate nature of healthcare, where I could be seeing clinician, a specialist, et cetera, for a particular need today, and my PCP may never hear about it unless I, as the patient, share it. So there are gaps that are created, I think, because of also just information flow and the challenges with information flow for a given patient, and what needs to get communicated to the overall care team. And so those gaps, again, big belief, provider driven, there's opportunity to help start closing them. Where do those gaps occur? And this is from McKinsey. I would say a simplistic view of patient experience. And McKinsey describes them as many journeys throughout that care journey, or the care pathway that takes place. And these 4 simple steps, and I believe there's obviously a number of others, but when we start to think about primary areas where gaps may occur, certainly scheduling is one of them. And I think as providers, as participants in the entire healthcare continuum, we hear about this a lot, right? So whether it's operators, whether it's on the patient experience side, we hear about scheduling challenges. We hear about patients not appearing for their appointments at the right time. And so gaps start to occur because of that. Gaps also start to occur because of any pre-op related activities that need to occur, whether it's an appropriate test, whether it's an appropriate series of measurements or diagnoses that needs to take place before a surgery. I have a good friend that's an oncologist, and in fact, family members that are various types of physicians. And one of the things they always point out is at a pressure point, and again, it only has to happen a handful of times in a week, or a handful of times for various patient experiences, and it starts to create this pressure where prior to a visit, the results from the lab didn't arrive, and all of a sudden now, if you're thinking about adjusting a regimen for radiation, you can't do that unless you have those lab results. And what starts to happen is there's a cascading effect of, okay, now I need to reschedule that visit. You have a slot that's suddenly become available. You have a situation with a patient that now all of a sudden is thinking, gosh, what's going on with my records? So there's an impact as well as satisfaction when we start to go down, some of these paths. And then certainly when we think about, other gaps that could occur is, whether it's day of surgery, and I think as providers, there's a heavy focus on quality, obviously. But the area that I'd like to particularly focus in on, and have spent a fair amount of time, just personally, is post-procedure or post-visit follow-up, and not from the perspective of, did the clinician provide the right instructions, or did the provider give the right set of information, but when the patient leaves the facility, the mechanisms that are in place to educate, to inform, to remind, and those are the follow-ups, I believe, that, particularly over the course of the next 1-2 years, from a healthcare system perspective, have the largest opportunity to close gaps in care. My father went through a bypass surgery a year or two ago, right here in the DFW area, a couple of years ago, in the DFW area, and I remember really high-class facility, fantastic team. But one of the things I recall from his discharge experience, and I remember speaking to my mom, I spoke to my father about it, and it was a successful procedure, surgery, et cetera. they were given a series of instructions about care, follow-up, what to look for, post obviously the surgery itself. And those set of instructions were, a lot of them were verbal. Some of them were written down and or on printed paper. But in terms of further follow-up, a week later, a couple weeks later, a month later, from the facility was frankly minimal. And I remember speaking to my mom about it. Post discharge, there's a lot of information that's being pre-discharge. There's a lot of information that's being shared, and some of it was being forgotten. So when we start to think about follow-up, in my mind, one of the major opportunities is education. And part of that education starts to drive and improve patient adherence and patient follow-up. And I think part of the follow-up, and thinking again about just personal experience, it's not just about the patient, but it's also about the individuals around the patient that are supporting him or her, right? And in particular, in this case, it was the family. Sometimes it may be the child, sometimes it may be a broader care team. As we go further in this conversation, this idea of follow-up and in particular thinking about ecosystem and how employer-driven plans are working now to improve healthcare and engaging with providers directly, engaging with physicians, with systems directly. Employers are also now starting to become part of that follow-up ecosystem to say, if you were diagnosed as a patient with diabetes, as part of that care plan, employers are starting to find mechanisms to drive behavior, to incent behavior, to improve that individual's life. But there's engagement now, there's follow-up that's taking place between the patient's care team and the employer in some mechanisms, and I'll share that as well. So that so the gaps can occur in a lot of places, but overall a high belief that if we focus on the patient, we focus around the individuals around the patient, we can really start to close those gaps. Why should we care, right? Given the audience that's on the call today, given the audience that's engaged in the healthcare ecosystem, first and foremost, it helps to deliver an improved patient experience. It's patient-centered. By reducing these gaps, we help obviously to improve lives, but frankly, there is an economic part to it. Whether it's you're part of a for-profit hospital system, there's economics involved. If it's a nonprofit system, there are other levers there that matter from a quote-unquote a business perspective. But the other reality is there are ratings, right? There's regulations in place that impact ratings for a facility, ratings for a physician, that by reducing these gaps in care, we start to move some of those other levers as well. So yes, we're going to help improve patient experience. Yes, we're going to help improve patient outcomes. And at the same time, there are the realities of running the specialty, the division, the facility, the system, et cetera, that all come to bear. And so again, I believe I'm probably preaching to the choir here, so to speak, in terms of why we should care, but I wanted to set that up. I believe the other, when we start to think about increasing expectations on the system or on the hospital, that's a big pressure point today. I think the way, they call it the medicine, the business of medicine has evolved. I think listening to friends, listening to clients, care delivery has evolved in significant ways and is only expected to accelerate in terms of how it's evolving. But when we think about those increasing expectations, and we think about it here even from a DFW perspective, and we can start to broaden the lens a little bit, there's increasing competition, whether it's thinking about, I use the word consumer choice and the retail side of it a lot, where there's questions about, if I want to buy, the most mundane thing that you could think of, a television, gosh, I could go to a number of places. I could go to Best Buy, go to Walmart, I can go to Target, I can go to websites, a number of spots where I have opportunities to buy a TV. I don't believe healthcare has gotten to that point where, it's going to be, it's currently as easy as, go online, identify opportunities to, get a slot to see a particular type of specialist. And then I, as the patient or consumer of healthcare, can start to choose which facility, which physician, which location that I'm going to go and visit. And healthcare in that way is transforming at a remarkable rate. And so this idea of, I believe, competition, and the competition is to help deliver that best experience to the patient, but competition is driving and, I believe, forcing hospitals and systems in some ways to really transform and transform quickly. And a lot of that transformation is occurring at the front lines, whether it's with clinicians and providers. I think it has been occurring in quote unquote back office functions for the last number of years. We'll certainly hear about it from the perspective of revenue cycle management or engaging the payer counterparts and make sure we're getting reimbursements and such done in the right ways. Reimbursement rates, I think some of those are further along, but competition from particularly other facilities and such is driving that. I think COVID has shown that also systems, providers, clinicians are being forced, are being asked, are being requested to do so much more, where the pressure on a clinician in terms of time in the day, some of that is administrative, whether it's, I hate to say it, but, sometimes the paperwork, sometimes the overhead of delivering care for a variety of reasons, and all those reasons, I think the group on the call here, frankly, probably knows way more about than I do, makes it such where, that pressure in terms of getting things done in the day is increasing. It's not decreasing. And then increasing expectations of frontline, right? COVID. I mean, just hats off to all the clinicians, providers, frontline staff that are on the call today. But increasing expectations have made the job at hand just much more complicated. And so then the question becomes how to reduce those gaps in care. And some of these I've talked about and discussed a few moments ago, where number one thing, and these are, I would say, elements that many of us have heard about. They're conversation points that occur. We hear about it from executive leaders. We hear about it from organizations that will share talks exactly like this. So I'm not sharing anything new, I believe, with these three, but I'm going to state them because I think they're important. So more frankly, I think reiterating. So number one is just link improvements and experience with outcomes, patient, but then also business outcomes. Number two, enabling the front line to really understand and identify what drives those gaps. And based on that understanding, to start making continuous improvements in addressing those gaps. We've talked about some of the gaps, previously, but whether the gaps are at discharge, whether the gaps are at scheduling or follow-up, whether the gaps are in a specialty where there's a series of instructions that we need to follow, and how do we ensure that those instructions are shared in a manner that are digestible, understandable by the core patient population that we might be serving. But if these are largely known, why then are those gaps still existing? And so, now I want to shift a little bit to what I believe are driving those gaps. And so we covered, what are those gaps? How do we potentially help make them, reduce those gaps? But then if we all know these things, what is really driving, perhaps the slower adoption of certain technologies, or the slower adoption or change of behavior of the patient populations that we serve? And I believe it comes down to these three things. Number one is habit. Human behavior can be changed. However, it takes significant repetition in order to change that behavior. So if we're trying to go down the route of smoking cessation, yes, we may, I'm not saying me specifically, but I as a patient that is a smoker, that I should not be smoking, et cetera. I know these things, but how do I start to change habit? And there are various reasons for that, and there are clinical reasons for that. But if we go down another path, or whether it's weight loss, or post a particular cardiac procedure, and I'm supposed to lose weight, or whatever it might be, habits are very difficult to change with patients. It's also true with all of us on this call, right? So if we're used to a particular way of completing documentation or completing our jobs at hand, changing those habits is difficult. And so overall, I think for consumers of healthcare, the patients, I think it's all about repetition. I think it's about using digital, and I'll talk to some examples of that, about how to share information through multiple channels, meaning share it digitally in an email, share it on a website, share it through SMS messages. I think all of us have probably experienced this, as part of the COVID response. I think what the CDC did in terms of, please register for CDC updates, tell us when you got your shot, and the automated set of messages that the CDC sends out to see, how are you, patient, feeling? You should be having another shot that's coming up. And again, it was just one question, sometimes two questions that came in. But those prompts, those interactive prompts, extremely helpful in changing habit. Now, us as clinicians, providers, staff on the system side, we don't have time to follow up with individual patients, individuals in that way, but that's where we start to say, what are some additional uses of technology that can help supplement what we as providers or we as care delivery teams need to do. The second thing, driven by that, and this is what I was highlighting, time is short, right? There's significant demands on time, like we were chatting about earlier. So if we're all being expected to do more, suddenly reaching out to an individual patient, even groups of patients, becomes very difficult. We're seeing innovation in the healthcare ecosystem evolve in this way where, if you've heard of Accolade, if you've heard of Castlight, these are organizations that engage with employers, large employers, think of the Fortune 500, and they say, you know what, you're gonna see a particular specialist. We as care coordinators are going to help navigate the healthcare ecosystem. And often that's think of it as a healthcare concierge, right? It's an individual that is picking up the phone, having a conversation with an employee at American Airlines, or having a conversation with an employee at Target, and saying, we recognize through a variety of reasons that you have care that needs to be taken care of. Or maybe the employee is reaching out and saying, I need a knee surgery. And these plans and these organizations start to help the employee navigate the environment because it's so complex. Choose which provider, choose which facility, choose where you're going to get your rehab done. And so Accolade and Castlight, and most recently Transcarent, is really trying to push down the path of using technology, heavily mobile app driven, healthcare guides if a consumer of healthcare needs it. Pick up the phone, a quick message away, whether it's in a chat, SMS, and then phone call if it's needed. But I think these innovations are taking place in the healthcare ecosystem to help address some of that time challenge that providers and clinicians feel and face, every single day. And then the third element is complexity, whether it's, I would say, the healthcare continuum complexity, or even frankly, system complexity. And I mean technology system, I don't mean the healthcare system complexity, the complexity of literally sharing information between various environments, between various channels of communication. the sheer complexity there makes it difficult. And I think that's the reason when we go back and say, if we know how we need to reduce these gaps, why is it taking longer to try to help reach this promised land? And and I think this is where it becomes on this group here and leaders in the system to start to say, okay, how do I change habit? How do I create more time? And how do I help reduce complexity for the various team members around us? And one of those answers, and I don't purport to say it's the only answer, is using analytics and is using automation to close those gaps. And whether it's breaking bad habits, whether it's creating time and living with the complexity, that's not going away. And a series of examples of organizations that I believe are doing it well. And I think HCA's announcement, earlier this week, I believe it was, with Google, around using data to start to say that Google is going to help develop a series of models, meaning algorithms, to help improve patient experience, both on the predictive side. So think of classically, given a series of diagnosis codes that were identified at a patient record level, what are some of the challenges that this particular patient may be experiencing that are coming up? And how do we then proactively start to say, this is a patient that needs to be scheduled for procedure X or visit Y or lab appointment Z, right? But that's the sort of direction that Google and HCA, I believe, are gonna go down. I know a number of the systems here in the DFW Metroplex, are innovating in the same way, right? Whether it's Parkland and the work that they're doing and kind of created that incubator environment, doing fantastic work to say, initially it was, what are some of the zip codes locally that we need to start to over-index on outreach? And then the work evolved to, as I understand it, I'm not super close to the work, but the work evolved to, given patient population, meaning demographic, zip code, et cetera, how do we appropriately start to handle some of the discharge conversations that need to take place from a Parkland perspective? So I think those are, some great examples. But then just based on my own personal experience, I think what Allina Health is doing in terms of combining patient satisfaction scores and surveying and the CCAPS environment, and now it's going to evolve to more of a net promoter score, type of concept. Those metrics, those scorecards, those analyses, very helpful in helping facilities and helping managers start to identify, what are some potential challenges that may be coming up, and whether it's on simplistically on the scheduling side, or on the quality of delivery of care, start to bubble up in that way. And so this idea of voice of the patient or voice of the consumer, is very helpful in identifying and being almost a leading indicator of issues that may be taking place. And that's I would say on a relatively simplistic side of it in terms of execution. And I know a number of systems and locally are doing that. But I know also that some of the more rural hospitals, some of the ones that don't necessarily have a team focused on experience, or their operational teams are very much focused on the core business at hand, that aren't able to execute on some of the other outreaches to their patient in that way. But that's where collaborations with third parties and such come in. Or I think the other thing that, the other area of focus from a United Health Group perspective, and obviously they have a series of groups and divisions and such, but whether it's partnering up on the Optum side and saying, well, how do we use, similar to what Google's doing on diagnosis codes and such, and saying focal points, or frankly with, local, their own bodies, right? So whether it's WellMed and such, we're thinking about patient more on a continuum perspective and saying, if we have PCP access, we have specialist access, how do we ensure that we're keeping the patient within the family, so to speak? And so that might be, if we were to take it a step further and say, a number of the systems here in town aligned with ACOs, obviously. So how do we keep it within the ACO family? But there's activity that we can execute and perform that say, in order to advance the savings, in order to advance the quality and the outcomes of the population, from an ACO perspective, how do we start to truly engage the population to say, let's make sure you're coming in to get that annual well visit, or if there's a at-risk population, just given a series of analyses around codes, given a series of analyses around history of visits, there may be populations where we say, even if it's proactively, and there's subtle ways of doing this, can say, here's information on weight management, diabetes, COPD. There's a whole series of communications that can be tailored to specific populations to say, how do we, again, how do we start to change behavior? And again, my overall philosophy is we need to make sure we're communicating consistently, regularly, and often in order to start to change that behavior. I mentioned Transcarent in a quick soundbite earlier. Transcarent really has come together very recently in terms of an organization through the acquisition of a number of other, I would say, brands, one of them being Bridge Health, which is a narrow network and around doing knee surgeries. But one of the big innovations that we're starting to see is, and it's, I think, been going on for the last maybe 3 to 5 years in particular, organizations that are focused on filling in these care gaps. And in this particular case with Transcarent and several others, the way they're starting to do it, or the way they're focused on doing it, is really through the employer side, recognizing that many, most of the population, I shouldn't say most, but, a large proportion of the population, is working for a large company. And sometimes it's government, sometimes it's a independent school district, but they're working for an organization, and by partnering with that organization to help close some of those gaps in care, particularly in terms of education, here's how to find the right provider, or here's the facility to select, or if you've been discharged, I think one of the biggest gaps or one of the biggest opportunities I believe we as hospital systems have is post-visit. I mentioned this earlier, or it's post-discharge, to ensure that the patient, to ensure that the members of the family and care team that sit around the patient know what was diagnosed, if it was a visit, or know what the discharge instructions are in a pretty minute level of detail if it was a procedure of some sort. And so Transcarent, others are helping us solve that. But I believe we as members in this council, we as systems have significant opportunity when we go back to this idea of competition and patients are choosing where to get their healthcare delivered as hospital systems by delivering some of the automations that come with automated messaging or follow-up information or appointments, et cetera, have the ability to improve that the experience that we see. The 5 patterns for success, that I've seen these organizations execute, and there's probably others on here that we could add, but I wanted to keep the list somewhat short. The number one thing is thinking about the patient first. I know it seems simple, but regardless of what part of the operation, regardless of which facility, regardless of what interaction point it is, whether it's front desk staff when somebody's walking into a facility, whether it's post-discharge, et cetera, it's just really thinking through that patient journey and saying, how can we deliver something that feels distinctive, that's memorable to that patient, because that impacts word of mouth and conversations that take place. The second is data-driven and tech-enabled. So using information, whether it's as simple as consumer surveys, patient surveys, satisfaction information, or the other end of the spectrum, feeling much more predictive in nature based on visit A, based on procedure codes that we see. Here is where patient, you may have some considerations to factor in, right, for a follow-up visit. Agile, I think we typically hear of agile from the perspective of technology development and execution in terms of building of software. Agile in this way means being ready to adapt, being ready to change. But what I don't mean is, changing, systems and the like. I truly mean this idea of testing out, picking the right specialty, maybe maybe it's on the PCP side of it, picking the right specialty to try some of that automated messaging, identify the situations in the value continuum or the healthcare continuum where it does require maybe more manual intervention, maybe there's additional steps that nurses and clinicians are expected to follow. Those become great areas to say, can we do a test to say, if we execute a message with, information to a patient, or if we use automation in terms of, pre-visit authorizations or information capture, there's a whole series of opportunities there to be agile and to be nimble and to test. Number 4 is this idea of cross-functional, where I've seen a number of organizations do this badly, where it might be just the technology team, or it might be just the operational team that says, we have a deployment, we have execution, or we want to try something, but it doesn't involve frontline staff, it doesn't involve the clinicians, it doesn't involve the providers in terms of thinking about how to impact change, or sometimes even including patients in terms of conversations, right? These classic focus groups and surveys and such. But this idea of cross-functional, I think, also matters. The last I'd say is start small and make it cheap. And what I mean by cheap is both in terms of time invested, but then also dollars and resources that are invested. It goes along with that idea of being agile, where you want to try something out, make sure it works. If it doesn't work, and again, I'm not talking about impact to, operations and procedures and such that have patient impact in that way, but really talking about it more from the perspective of communication and patient engagement, where you try something, if that didn't work, we tweak the messaging, or we try a different method of communication. Those are the types of patterns I'm seeking to highlight. So it's not necessarily saying on the clinical side of care delivery, but really truly more on the patient experience and conversation side. The rest of the document, and I know this will be shared, highlights a little bit of what we do from a NectarOM perspective, focused on digital marketing and consulting, team of expert consultants, heavily focused on data and digital and that intersect. Been doing this for many years, both in retail, healthcare. We believe in this idea of being analytics-led and technology-driven. Our operating model brings in practitioners, experts, and done in a way that focuses on customer and patient strategy, typically at board and I would say C-suite levels, but then truly building out those journeys from a patient perspective, from a customer perspective, and thinking about how we need to engage different patients, or I use the word customer very broadly, because fundamentally even a consumer of healthcare is a customer. Yes, they're a patient from a clinical perspective, but I believe the mindset is evolving to say patients have choice. They're a customer when we start to think about our healthcare systems, when we think about healthcare delivery and how they're engaging with healthcare. Analytics, and particularly from the idea of marketing, and I know the word marketing for many systems in healthcare can sometimes be seen as frankly a dirty word, where nope, we don't market, we're focused on outcomes and the quality of care, and I believe that's absolutely right. I'm not saying to detract from that in any way, but also for the experienced teams, for if the system has a true marketing organization or team members that do things like social media or updating websites or sharing content in email. Those are classically marketing, I would say, tactics. And so, we think about how do you activate on data that we can learn based on engagement on a website? Are there certain pieces of content that seem to resonate more closely with the audience we're seeking to reach? And that's the type of analytics that we're talking about there. It also goes further to say, there are a number of systems that do, large-scale television advertising right here in the DFW Metroplex, or spend on brand marketing, whether it's on social media or classic advertising. So those are marketing tactics where we start to say, let's measure the outcome of what that engagement from a marketing perspective is driving, and how do you start to optimize and allocate funds and budget to think about getting the message out there and building the brand. Then certainly this notion of scaling technology, where we need, a lot of what we end up doing, and even the examples that I've talked about, while it has the, the balance of clinical outcome, business outcome, patient outcome, in order to deliver at scale and in order to automate and use those analytics, there are a number of elements of technology that can be helpful in the process. I don't believe in the near term technology is going to overtake in the way that it has in some other industries for healthcare, but I have a strong belief that as you fast forward about a decade, maybe 15 years, the role of technology and how it's going to change healthcare delivery, particularly around things like triage, and I don't mean in the ER, but pre-visit or post-discharge or access to information. I think healthcare is going to be democratized in a significant way over the next decade in particular, where technology helps to bring information into the hands of the consumer of healthcare, into that customer, in ways that I believe are just going to drastically change how healthcare is delivered. And then there's this side of actually getting the campaigns or the conversations executed, and that's where marketing operations come in. We work with a whole series of technologies. The reasons why United Health Group or Alina or a number of other systems, and in fact we're working with a couple here in town, engage with us and work with us. It's truly a partnership. It's your vision realized with our experience. We believe in supplementing how you engage and what you do. It's amplifying existing investments, or it's not about let's rip out what you have and go and do something new, but truly working with your collective teams to help deliver and execute. I'm here to help. My information is shared on the page here, and I believe even as part of the webinar, this recording will be shared and information will be provided. With that, Steve and Chris, if you're still on the line, we'll pass it over to you to see if there are any questions that came in, but effectively this completes the formal part of the presentation.
Thanks, Amber. Really great information, and I really like the way you tied it into the gaps that we have, and even based on personal experience. We do have a couple of questions. We have a radio show that's done weekly called The Human Side of Healthcare, and this question dovetails nicely with that. With all the discussion about automation and analytics, how do we not lose that human side of healthcare when we provide care to our patients?
Yeah, and Steve, it's a topic I spent a fair amount of time thinking about, where particularly even as I was going through the last number of slides and we were talking about using analytics and using automation to reduce gaps in care. I mean, these are very, I would say, tactical, perhaps solutions, ways of thinking to solve very specific problems. But at the end of the day, one of the comments I made earlier was this idea: it has to be patient-centered. That is one of the core elements of creating success and closing these gaps. And so this idea of the human side of healthcare and addressing it with analytics and automation, of all the things that we experience as individuals, maybe experiences with the family, whether it's the birth of a child, whether it's a major event. Those are very human, experiences. But healthcare, particularly when you just left the doctor's office and maybe your child, and forget, maybe ourselves, but let's say your child diagnosed with a serious condition, that is about being an individual, about the heart, about how we feel. No machine, no amount of analytics, no amount of automation can remove or I would say replace the heart in that conversation. Taking it another step further and saying, gosh, as part of a procedure or as part of a visit, I mean, and this is a real scenario. I mean, you can go to Amazon's office, you can go to certain retailers' office, Best Buy is one of them. They have bots that actually drive around and move around and deliver information. And, you can have, and some of us on the call may have seen these things, but, video monitors that drive around as if it's that individual. So there's technology that makes it feel like, here's a video screen and moves around and it's a robot. But that's not human, when we're talking about healthcare and the experience of an interaction with a clinician and an interaction with a provider, that human side of it will never go away. My perspective on it, and I'll wrap up the answer here shortly. My perspective on it is technology, analytics, automation, etc., supplements what clinicians and providers do. It doesn't replace the heart part of it. Now, I'm hopeful and I believe that by the use of appropriate technology, that it creates more time for the clinician to spend with the patient, that it reduces some of the complexity that I was highlighting, that it makes it easier for a patient to adhere to their care plan, that the technology again supplements it. But in healthcare, I think is one of the few places that it's not going to get overrun, in the same way as others in terms of robots, running around.
That's a great answer, and you're right. Hopefully the automation will give the clinician more time with the patient. Amric, I've been here about 14 years, but prior to that, I worked over 30 years in hospitals, and it's hard to change patient behavior. What have you seen to be successful in improving overall patient compliance and adherence to what the provider wants them to do?
I'd say, Steve, number one thing is incentives. Behavior is hard to change, and we can use, again, have a belief that you can use technology and regular messaging, et cetera, to remind, to educate, to inform. But I think there's also this notion of, well, what's the incentive? Sometimes, and did a whole series of tests with United Health Group around this, where certain patient populations providing devices, right? So whether it's, hey, if you're able to adhere to the following plan, there may be an Apple Watch in it, or as part of your, certain behavior change, frankly, and if you're allowed to, given the situation, here's a monetary incentive, and maybe the monetary incentive is we're going to reduce the price, right? We're going to reduce the copay. We're going to reduce the deductible. We're going to reduce out of pocket. We're going to reduce something where if you follow patient X, Y, and Z in terms of the activities that you're supposed to, you adhere to the care plan, the direct incentive to you is monetary. The secondary would be the idea of a device or an item. So in addition to trying to educate and the like, the other component I've seen that changes behavior, frankly, at the end of the day, are these very tangible incentives. I mentioned Transcarent, I mentioned Castlight and Accolade and such. On the employer side, what I'm seeing there is constructs where, if let's say you've got a medium or high deductible plan, if you follow the following set of activities, if you're doing your annual physical, if over the last 1, 2, 3, 4, 5 years, your utilization of healthcare has looked like the following. Here are discounts almost against your deductible. Think of, what Allstate does, or I think it's Allstate, does with car insurance. If you haven't had an accident, you haven't had a ticket, if you haven't had, the bad behaviors that we're seeking to mitigate, here are financial benefits in terms of reduction in your monthly payment, right? Or the reduction in the deductible. So I've seen those work pretty darn nicely. The other area, and we're actually doing some experiments on it. I don't have a great data on it quite yet, but I'm hopeful in the next maybe 90 days, 120 days. So in addition to engaging the patient, you start to think about the care team, right? And I don't mean the clinicians, but what I mean there is members in the family. So what I've also seen is, and we're doing experiments where you start to engage the members in the family as part of that care delivery process, to be that ongoing voice, to almost be the eyes and ear of the clinician, to be able to articulate and say, if it was post procedure, temperature checks, or how's somebody feeling, or is there any other information that you need, or hey, I saw that Jane or John Doe didn't make it for the appointment. Anything we can do to help reschedule, or do you need a ride, or but it's not just engaging the patient directly, but also engaging, I would say, that extended care team, and seeing really interesting results and some key demographics in that way. Some of it is on the elderly, and then I would say the other group that we're seeing some really positive results is with at-risk communities.
You mentioned insurance companies and, some other industries. We're not completely back to normal at hospitals. We're still treating COVID patients, but our frontline staff continue to deserve kudos for the hard work they're doing. And I know your background with McKinsey, so you know about Toyota and Lean. But as we get back to normal in hospitals, and as we look to continue outpatient procedures, deal with certain specialties, follow-ups, is there any advice you can give us related to behavior shifts that you've seen in other industries that may be applicable to hospitals and hospital systems?
Yeah, if behavior change, long-term behavior change is hard, I would say sometimes short-term behavior change is actually easier to accomplish. And I'll use a non-healthcare example for just a moment, but I think it'll maybe bring the point home. Starbucks, and I don't know how many folks are on the call today, but whatever the number is that are on the call, probably half of us have been to a Starbucks, I would say, in the last year. If you extend that to 18 months, it's almost a definite, half, 50%. And one of the things that they've done during COVID time in particular, and if you're a member of the reward program, you'll know what I'm talking about. They've gotten very aggressive on, hey, come in on a certain day and you're going to get bonus points. Buy a certain number of items or spend a certain amount of money, you're going to get X, Y, and Z. And so one of the experiments we ran with a system up in the Twin Cities and in Minneapolis was, we recognized that at their primary care locations, they had big gaps in terms of appointments available. And they'd been doing outreach and, and the like, but it was, I would say it was sporadic in terms of the type of outreach, just given, the number of items are on the call for the front office staff, on the list for the front office staff. So they were able to do appropriate outreach. And so we said, okay, we have opt-in, we have ability to reach out over SMS, we have ability to reach out over email, and we basically ran a series of prompts where we said, hey, patient X, it looks like, we haven't seen us in the last, 12 months, and, if you're an ACO, you start to get into some challenges if you're thinking about, attribution and the like, so there's some other benefits to this as well. But, hey, patient, we haven't seen you in the last 12 months. It looks like at Facility X on the corner of Main and First, we have appointments available between 1 and 3 p.m. this coming Friday. Do you want to hop in? And so what we saw was it was a 24%, I could say 25 to round it, but 24% increase in appointment uptake as a result of doing that simple prompt. And it wasn't, hey, please come in and schedule your follow-up or your annual visit. The prompt was, come in on this day between this times, and if you need the appointment, and we've got it available for you, right, between these slots. And it was there was some automation on the scheduling and such, so that it wasn't inundating the front office staff. But I think the learning there is, gosh, if we can be very specific, and what we're trying to do is almost remind and indicate, hey, patient, we're making it easier for you. Come in between this time and that time and set up an appointment. That uptake we saw, we were expecting maybe 5 or 10%. So it was more than double where we thought it would be in terms of uptake. But it was just the tactic and frankly how we did that. We did that outreach where we saw the type of lift in engagement.
Great. That's a great example. I know Chris is checking the question box. Do you see any more questions, Chris?
No, I do not.
Okay. Amric, what a great presentation, what a great discussion, really dealing with gaps in healthcare. I think we've covered all the questions people had, but we thought we would let you have a final comment or closing thought before we close down the webinar.
No, absolutely. Steve and Chris, number one, just really appreciate you having me on today. Again, as anyone has any questions, comments, etc., or even just reactions, if you have disagreements with some of the points I made, just feel free to reach out, and would love to continue to engaging with the group accordingly.
Well, thank you so much. Great education material here, and thanks to everyone that's participated. And I hope all of you will not only have a great rest of the day, but a very safe Memorial Day weekend.
All right. Thank you very much.
Thanks.
All right. Bye-bye.